Welcome to Brandon's Awakening channel. In this video, we will talk about behind addiction, the real causes and effective treatment methods. Follow us. But first, don't forget to subscribe to this channel and like the video. Let's get started with the video. Addiction is a complex phenomenon that affects millions of people worldwide. While society often tends to view addiction as a weakness of willpower or irresponsible behavior, the reality is much more intricate. Addiction is not just a bad decision or a lack of mental strength. It is the result of a multitude of interconnected factors, psychological, biological, and social. To truly understand the causes of addiction, we must delve deeper into its roots and explore the factors that contribute to its development and impact. 1. Biological factors. How does neurochemistry affect addiction? One of the most significant real causes of addiction lies in biological factors, as the brain plays a crucial role in shaping addictive behaviors. Every time the brain is exposed to a particular substance, whether it's drugs, alcohol, or even compulsive behaviors like gambling, it releases chemicals known as neurotransmitters, such as dopamine. Dopamine, often referred to as the feel-good neurotransmitter, creates a sense of pleasure, reinforcing behaviors that lead to this feeling. Over time, individuals need a larger quantity of the substance to achieve the same effect, tolerance, which strengthens the addictive cycle and leads to physical dependency. 2. Psychological factors. Internal pain and escaping reality. Addiction often arises as an attempt to escape internal suffering or psychological pain that feels unbearable. This pain might be tied to traumatic childhood experiences such as physical or emotional abuse, betrayal, or loss. Individuals suffering from this internal turmoil may turn to any means to alleviate the pain, and drugs or addictive behaviors offer an immediate escape. While these substances may provide temporary relief, they do not heal the inner wounds and often worsen the problem over time. 3. Social factors, environment and peer influence. The social environment plays a significant role in accelerating the development of addiction. In communities where addictive substances are easily accessible, or where addiction is normalized in certain social circles, it becomes difficult for individuals to resist these tendencies. Friends or family members may even become part of this dynamic, exerting social pressure to try or continue using certain substances. A culture that minimizes the dangers of addiction or believes that everyone is doing it fosters a false perception of addiction, which aids in its perpetuation. 4. Genetic factors. Is addiction hereditary? Research has shown that there is a genetic component that can contribute to the development of addiction. People with a family history of addiction are at a higher risk of developing addictive behaviors themselves. This is due to genetic differences in how the brain responds to rewards and stimuli. However, possessing a genetic predisposition does not guarantee that an individual will develop an addiction. This interacts with environmental and psychological factors to determine the likelihood of its occurrence. 5. Cultural factors. How culture shapes our perception of addiction. The culture we live in plays a major role in shaping how we think about and approach addiction. In some cultures, drug and alcohol use may be seen as socially acceptable or even encouraged, whereas in others, addiction may be viewed as a severe moral failure or a source of shame. How addiction is perceived and addressed culturally influences an individual's understanding of the issue and their willingness to seek help or change. 6. Economic factors. Poverty, unemployment, and material struggles. Economic hardship, unemployment, and financial stress can be powerful triggers for addiction. When individuals feel overwhelmed by a sense of powerlessness, they may see addictive substances or behaviors as the only way to cope with the daily pressures and anxieties of life. Increased stress from economic instability can lead to heightened feelings of anxiety and depression, which in turn make the temptation of addiction stronger. 7. Addiction as a coping mechanism. How people deal with life's pressures. In some cases, addiction functions as a coping mechanism to deal with the pressures of daily life. Life can be filled with constant challenges, work stress, relationship difficulties, or even an overwhelming fear of the future. In these moments, individuals may seek an outlet through addiction. This coping mechanism may feel effective in the beginning, but it ultimately creates a vicious cycle that becomes increasingly difficult to escape. How can we overcome addiction? Addiction is a serious and multifaceted condition that requires a comprehensive approach to treatment. Overcoming addiction is not just about stopping substance use, it involves healing the mind, body, and soul. The treatment process typically involves a combination of strategies, depending on the individual's needs and the type of addiction they are facing. Below are some of the most effective treatment methods for addiction. 1. Detoxification, detox. The first step in treating addiction is often detoxification, where the body is allowed to rid itself of the harmful substances that have been consumed. This process is typically medically supervised, as withdrawal symptoms can be severe and even life-threatening in some cases, especially with substances like alcohol, opioids, and benzodiazepines. Detox is not a standalone solution but is a necessary first step before engaging in more comprehensive rehabilitation treatments. It clears the body of the substance and helps manage withdrawal symptoms, preparing the individual for further treatment. 2. Behavioral therapy. Behavioral therapies are one of the most effective treatment methods for addiction, especially for individuals dealing with substance abuse or behavioral addictions such as gambling. These therapies focus on changing the thought patterns and behaviors that contribute to the addiction. Some common types include cognitive behavioral therapy, CBT. CBT helps individuals identify and change negative thought patterns that lead to self-destructive behaviors. It encourages healthier coping mechanisms and problem-solving skills. Contingency management. This approach uses rewards to reinforce positive behavior, like staying sober, and discourages relapse by offering incentives for maintaining sobriety over a period of time. Motivational interviewing. This therapy focuses on enhancing a person's motivation to change by exploring and resolving any ambivalence about quitting. It helps build the individual's confidence and desire to take action. Dialectical behavioral therapy, DBT. DBT helps individuals struggling with extreme emotions, often seen in people with addiction, to develop better emotional regulation, distress tolerance, and interpersonal skills. 3. Medication-assisted treatment, MAT. Medication-assisted treatment, MAT, involves the use of prescribed medications in combination with therapy to help individuals manage withdrawal symptoms, reduce cravings, and maintain sobriety. This approach is especially effective for people with opioid addiction, alcohol use disorder, and certain other substance use disorders. Some commonly used medications in MAT include methadone and buprenorphine. These are used for opioid addiction to help reduce cravings and withdrawal symptoms, allowing individuals to stabilize and focus on their recovery. Naltrexone. This medication blocks the effects of alcohol and opioids and can help prevent relapse in individuals recovering from alcohol or opioid addiction. Disulfiram, antabuse. This is used in alcohol treatment to cause unpleasant reactions when alcohol is consumed, which discourages drinking. MAT is not a cure but a vital component of a comprehensive treatment plan that can help individuals stay sober and build the tools needed to maintain long-term recovery. 4. Inpatient and outpatient rehabilitation programs. Inpatient rehab. This involves residential treatment where individuals live in a treatment facility for a specified duration, typically ranging from 30 to 90 days. Inpatient rehabilitation provides 24/7 medical supervision and intensive therapeutic interventions. It is particularly useful for individuals with severe addiction or those who need a highly structured environment to break free from substance abuse. Outpatient rehab. Outpatient programs offer flexibility, allowing individuals to attend therapy sessions and support groups while still living at home. These programs are less intensive but can be effective for those with a lower level of addiction or as a step down from inpatient treatment. Outpatient rehab often includes group therapy, individual counseling, and educational sessions about addiction and recovery. 5. Support groups. Support groups are essential for maintaining sobriety and preventing relapse. These groups provide a sense of community and accountability, allowing individuals to share their struggles and successes with others who understand their experiences. Some well-known support groups include Alcoholics Anonymous, AAAA, is a peer support group for people struggling with alcohol addiction. It follows a 12-step program to help individuals achieve and maintain sobriety. Narcotics Anonymous, NANA, is similar to AA but focuses on individuals dealing with drug addiction. It also follows the 12-step model. Smart Recovery, this is a self-empowerment program that helps individuals develop skills to manage addiction through cognitive behavioral techniques and scientific approaches. Support groups provide ongoing support during and after treatment, and they can be incredibly helpful in maintaining sobriety and preventing relapse. 6. Holistic and alternative therapies. In addition to traditional treatment methods, many people benefit from holistic and alternative therapies that focus on healing the body, mind, and spirit. These therapies aim to address the underlying issues that contribute to addiction and promote overall well-being. Some of these therapies include yoga and meditation. These practices help individuals manage stress, increase self-awareness, and develop mindfulness. They are effective tools for emotional regulation and promoting mental clarity. Acupuncture. Some people find relief from cravings and withdrawal symptoms through acupuncture, as it is believed to help restore balance to the body's energy and reduce stress. Art therapy. Creative therapies, such as art or music therapy, allow individuals to express their emotions and experiences in a non-verbal way, helping them process trauma and heal. Nutritional therapy. Proper nutrition is often overlooked in addiction treatment. Eating a balanced diet can help restore physical health, regulate mood, and reduce cravings. 7. Aftercare and long-term support. Recovery doesn't end when treatment finishes. Aftercare is critical for ensuring long-term sobriety. Aftercare services include ongoing therapy, support group meetings, and regular check-ins with a counselor or recovery coach. Long-term support helps individuals navigate the challenges of reintegration into society, develop new coping strategies, and stay connected to their recovery network. Sober living homes. These are transitional living facilities where individuals can live in a supportive environment as they adjust to life outside of treatment. These homes often provide structure, accountability, and a safe space for those in early recovery. Relapse prevention planning. After treatment, individuals often work with therapists to develop strategies for managing triggers, avoiding risky situations, and responding to cravings, thereby reducing the risk of relapse. The treatment of addiction is not a one-size-fits-all approach. Success in overcoming addiction depends on a combination of methods tailored to the individual's needs, the substance they are addicted to, and their unique circumstances. Detoxification, therapy, medication, rehabilitation programs, and support groups all play essential roles in the journey to recovery. The road to recovery can be challenging, but with the right treatment plan and ongoing support, individuals can overcome addiction and lead fulfilling, sober lives. Recovery is possible, and the first step is seeking help. And in the end, if you liked the video, don't forget to subscribe to the channel and like the video. See you soon. Goodbye.